when Chuck Schumer is saying this is getting better for us every day, that's not somebody who wants to see this get resolved. And they are pandering to the left-wing special interest groups out there who have demanded this and demanded this showdown with the President of the United States. And so we've got a bill, as I've said, that's passed the House, that's sitting at the desk in the Senate that we could pass today, put it on the President's desk, he would sign it into law, and this shutdown whole fiasco ends, and people can get back to work.
That was Senate Majority Leader John Thune on Squawk Box just a couple of minutes ago. Now we're going to get some reaction and his thoughts about where this all heads from House Minority Leader Hakeem Jeffries. Good morning to you. We'll start there. What do you make of those comments?
Well, our view is that we will sit down anytime, any place with anyone here at the Capitol or back at the White House, including with the President, in order to reopen the government, find a bipartisan path forward to enacting a spending agreement that actually meets the needs of the American people and improves their quality of life as opposed to hurting everyday Americans. And of course, anything that we do has to decisively address the Republican health care crisis that is real. It's not fake. It's not irrelevant. It's not random. It's a real health care crisis, including the urgent need to extend the Affordable Care Act tax credits for tens of millions of Americans who are about to experience dramatically increased premiums, copays, and deductibles because of the Republican refusal to act.
Right. I appreciate your position on the health care issue. The question I have is, there's clearly a game of chicken going on here, and I think it was expressed in many ways by Senator Schumer in terms of how strategically there is a view among Democrats that the longer you can hold out, perhaps the better chance you have either to get what you want or to push the Republicans into some kind of other place. And my question to you is how you think about that, given the trade-off, of course, which is all of the government workers which are currently being furloughed and not being paid.
I think that Leader Schumer and Senate Democrats have taken a strong and principled position for all of the right reasons in the face of this Republican health care crisis. Remember, this is something that has been ongoing from the very beginning of this Congress. The largest cut to Medicaid in American history, forcing, we believe, 14 million people off of health care coverage. Hospitals and nursing homes and community-based health clinics are closing right now, all throughout the country, including in rural America, because of what Republicans did in their one big ugly bill. Medicare is facing a possible cut of $536 billion at the end of this year if Congress doesn't act, connected to that toxic piece of legislation that Republicans enacted, which hurts everyday Americans in order to reward their billionaire donors with massive tax breaks. And by the way, those tax breaks were made permanent. And then now we're facing the Republican refusal to extend the Affordable Care Act tax credits in an environment where the cost of living is already too high, and Donald Trump has broken his promise to lower costs on day one. And by the way, on top of all of that, medical research has been effectively ended in the United States of America. And in this Republican appropriations bill on the House side, they want to cut funding for the Centers for Disease Control by $1.7 billion and cut funding for the National Institute of Health by $500 million. This is extraordinary stuff. And we are simply not going to go along to get along the Republican effort to continue to gut the health care of the American people. This is a cost of living issue, and it's a life or death issue for millions of Americans.
Senator, but we're talking about a continuing resolution to keep the government open and then going into the normal appropriations process. I mean, there was an election, and the Republicans were put in a position where they were able to pass the big, beautiful bill, or you call it the big, ugly bill, to then say, we don't like any of that, so we're going to shut down the government until you take back all the things that you duly passed through legislation. If Republicans had tried to do that to the Inflation Reduction Act or the any of the acts that Biden and that administration have passed, if they said we're going to shut down the government because we don't like any of those things you did, we're going to not pay our military, we're going to, not allow the government to reopen until you do what we want. After an election where the American people put Democrats in power, you'd be going crazy. You'd be going crazy about using a shutdown of the government with a continuing resolution to get what you want just because you don't like what the Republicans did. It's not how it works. It's bad. It's bad precedent, and it's just clear. And you're talking about the House. You've already passed this. The Senate is who we're talking about, and they have a bill which will reopen the government right now with 5 more Democrats.
What is bad precedent is the Republican refusal to engage in bipartisan negotiations. What is bad precedent is the Republicans embarking on a my way or the highway approach from the very beginning of this Congress. Republicans control the House, the Senate, and the presidency. Joe, you're exactly right. So if the government shuts down, they've made the decision to shut the government down. And they can reopen it right now if they chose to, with a rule change in the Senate. But I just explained it. The reality is they want to keep the government closed. Cruelty from the very beginning of this administration has been the point. And the responsible thing to do is to sit down and negotiate a bipartisan path forward to address a very real health care crisis that's upon us right now. Open enrollment starts on November 1st.
Can you do those negotiations while the government is reopened? I think that's the offer that's been on the table. We did hear the House Speaker, Mike Johnson, talking about how, look, he passed a clean CR. There's not really much for him to politic in because there's nothing to take out. Any Republican pork that they pushed into this to take out of it to offer as a way of getting around this. Can you reopen the government and have these conversations if there's a willing party on the other side, which it sounds like there is if you talk to some of the Republicans who see this as an issue in their district as well?
Well, certainly Marjorie Taylor Greene has made clear that it's a very real issue. It's an issue that Republicans have ignored throughout this year, and it's an issue that needs to be addressed right now. Mike Johnson has made the representation, including at that White House meeting that we had last week, after Chuck Schumer and I reached out to demand that we have the conversation. Unfortunately, it took place literally a day before the government shut down because Republicans have refused to engage in bipartisan negotiations or even conversations up until this point. And our view is, what Johnson said is that health care is an irrelevant, extraneous issue. No, it's not an extraneous issue. It's a central issue. And we need to deal with it right now. And we're willing to sit down and have that conversation. We want to reopen the government. But you're not going to fix this. That's
a negotiation that is going to take a very long time. Employees, including the military, are not going to get paid on October 15th. Can you have these negotiations?
And that's an issue that we believe should. And that's an issue that we believe should be dealt with respect to our troops in a bipartisan way, in a manner that it has been dealt with in the past in previous shutdowns,
in the past, you've had appropriations
in
bills
October
that had already
of
been
2013.
For the right.
I'm talking about in October of 2013, where as a standalone issue, the military pay for our families and men and women in uniform was dealt with. That's what I'm making reference to. So who should get paid besides the military? You think the TSA agents should get paid? Where does the line stop for who gets paid and who doesn't? The law requires everyone to be paid, and unfortunately, Donald Trump has once again suggested that no one is going to get paid, which to me is consistent with the efforts to undermine the rule of law that we've seen from this administration from the very beginning. Listen, our position just remains clear. We just want to have a serious bipartisan discussion about reopening the government and enacting a spending agreement that meets the needs of the American people. And we disagree with the notion that the March partisan continuing resolution, which they put before us once again, is actually clean. No, it's not. We opposed it in March because it represented, in our view, an attack on veterans, an attack on nutritional assistance, an attack on women, infants, and children funding, an attack on housing affordability, and an attack on health care. That's not a clean continuing resolution in our view, and it was not bipartisan. Certainly that wasn't the case in the House.